Hello students, welcome to the class. Today we will discuss something about female reproductive system. The female reproductive system contains following parts. First is cervix, then vagina, then upper part is known as uterus and two ovaries. Two ovaries are attached with two fallopian tubes. The female reproductive system consists of following part and ova produces eggs. It also produces female hormone known as estrogen and progesterone, which contains or which gives the secondary sexual character of the female. The supportive and protective part of the total embryo contains within the uterus, and the female reproductive system, with the help of the female reproductive system, give a birth of a new baby. Then the major organs are cervix, vagina, ovaries, uterine tube is known as also fallopian tube, and uterus. The cervix is the first part, which is mainly attached to the vagina, and ovaries. Two ovaries are there. Two ovaries produces ova. The cervix, the lower portion of the neck of uterus, is known as cervix. The cervix lined with the mucus known as cervical mucus, and the cervical mucus provides lubrication and sperm transport during sexual intercourse. During ovulation period, secretion of cervical mucus increases in response to estrogen production. But when the egg is ready for fertilization, the mucus then becomes thin and slippery and offering a friendly environment to sperm. This is the cervix structure. At the end of pregnancy, the cervix acts as a passage through which the baby exits the uterus into the vagina. The cervical canal expands 50 times its normal width for the passage of the baby during birth. Then comes to vagina. The blood supply. The blood supply to the vagina is from the vaginal artery, the branch of the internal iliac artery, and the vaginal branch of the uterine artery. And lymphatic drainage also occurs inside the vagina. The lymph from the upper vagina drains into the internal and external iliac nodes. The lymph from the lower vagina drains to the superficial inguinal node. The endometrium. The endometrium is the innermost layer of the uterus. During the menstrual cycle, the endometrium grows to thick, blood vessel rich glandular tissue layer. This represents an optimal environment for the implantation of a blastocyst upon its arrival in the uterus. It is the normal endometrium which is present inside the uterus wall. It is the very softest muscle. Then labia majora, the outer lip-like structure having with darker pigmentation, is known as labia majora. It protects the intrauterus and uteral opening muscle and are covered with hair and sebaceous glands and become flaccid with the age and after childbirth. Then labia minora. It is also referred as inner lips of uterus, made up of erectile connective tissue that darkens and swells during sexual arousal. It located inside the labia majora. They are more sensitive and responsive to touch than the labia majora. The labia minora tights during the intercourse. Then mons pubis, the triangular mound of fatty tissues that cover the pubic bone. Pubic bone is present in our pubic region. It protects the pubic symphysis. During adolescence, the sex hormones triggers the growth of pubic hair on the mons pubis. Hair varies in coarseness, curliness, amount, color, and thickness. Then comes to ovary. Ovary mainly produces ova, blood supply. The ovarian artery are present and a branch of abdominal aorta contains the ovarian artery and gives blood supply to the ovary. Then venous drainage. To the interferior of vena cava on the right and left renal vein on the left side. The venous drainage occurs and lymphatic drainage to the para-aortic nodes. The lymphatic drainage occurs. This is the two ovaries, also known as female gonads. They produce eggs and the eggs are also called as ova. Every female is born with a lifetime supply of eggs. They also produce hormones, estrogen and progesterone. Here is the ovary. The ovary contains with the vaginal touch with fallopian tube, and when the ova mature it goes the fallopian tube, and when sperm comes the zygote is produced inside the fallopian tube. Then fallopian tube stretch from the uterus to the ovaries and measure about 8 to 13 centimeter in length. The ends of fallopian tubes lying next to ovaries feather into ends called fimbriae. The millions of teeny hair-like cilia are present inside the fallopian tube. The cilia weave in the waves hundreds of times a second, catching the egg at ovulation and moving it through the tube to the uterine cavity. The fertilization typically occurs inside the fallopian tube. This is the structure of the release of egg from the ovary, and after release it undergoes the fallopian tube. The fallopian tube is feathery like, contains feathery like structure, and inside the fallopian tube, number 2 diagram, inside the fallopian tube the egg is there. The egg reached the midpoint of the fallopian tube where it is fertilized by sperm, and implantation of fertilized egg into the endometrium of the uterus. After fertilization occurs in the fallopian tube, the zygote undergoes and remain and stay inside the uterus. Then uterus, pear-shaped muscular organs in female reproductive tract. The fundus is the upper portion. Uterus is contains three parts. The fundus is known as upper portion of the uterus where pregnancy occurs. The cervix is the lower portion of the uterus that connects with the vagina and serves as the sphincter to keep the uterus closed during the pregnancy until it is time to deliver a baby. The uterus expands considerably during the reproductive process. The organs grows to form 10 to 20 times greater its size to normal size during pregnancy. This is the structure, entire structure of the uterus. The main body consists of a firm outer coat of the muscle is known as myometrium, inner layer, and glandular material is known as endometrium. It is the innermost layer. The endometrium thickens during the menstrual cycle to allow implantation of fertilized egg. Removal of a fertilized egg. The pregnancy occurs when the fertilized egg implants successfully into the endometrial lining. The relation of uterine. Anterior, the uterus and cervix are related to the uterovesical pouch and superior surface of the bladder. And the posterior part, the uterus is related to the recto-uterine pouch, which extends down as far as the posterior fornix of the vagina. This is the uterus structure. Fundus of uterus. Middle one is the fundus of uterus. The body of uterus is flattened anterior posteriorly in the above level of the origin of uterine tubes. It has a rounded superior end is known as fundus uterus. The cavity of the body of uterus is a narrow slit when viewed laterally. It is shaped like an Inverted triangular when viewed anterior. Triangular shape when it looks in anteriorly. This is the ovary. This is the side view of your uterus. Then different glands. Then middle one is cervix. Then urethra, pubic bone, side bone is known as pubic bone. Then middle one is the bladder, urinary bladder, which is attached to the upper side with uterus. And here is the ovary and fallopian tube. Thank you.